Good day. Our topic for today is advancing through learning, continuing professional development in nursing. So your CPD is a lifelong process for nurses. So it enhances your skills and maintains professional competence through formal and informal learning. So understanding your CPD. Your CPD journey is a lifelong process. It is not a destination because it is a continuous process of learning and development through a nurse's career. So the core principle of this is that not just the courses or certifications, but the mindset of ongoing improvement. So it reflects dedication to excellence in patient care through constant skill enhancement. So why CPD matters? It matters because it's the foundation of excellence. So it maintains your core competencies and we are updated with your medical advancement. And we are doing this to implement the evidence-based practices for our quality patient care. And your CPD matters because of your professional excellence. In CPD, we achieve the highest standards of nursing practice. So the formal education pathways, we can do your academic courses. So we have your postgraduate certificates, diplomas, no, your masteral, and degree programs that build specialized knowledge. We have also workshops. So we have your structured learning events featuring expert presentation and hands-on training. Then we have your certification programs, uh, like your specialized training culminating in your recognized credentials for specific practice areas. So we have example of these, your um, NRPH, no, neonatal resuscitation program, or we have your BLS or your basic life support. And we have your seminars and webinars that focus on educational sessions and specific topics available in person or online. So this is most often being offered through online or through webinar. So we have your application of that. An example of this is your Docquity. So informal learning, knowledge beyond your classroom. So we have your reading journals, so staying current with your research through nursing and medical publications. We have your professional network, so exchanging knowledge with colleagues through the communities of practice. So in our profession as a nurse, we have um, your Pambansang Samahan ng mga Nurses Network. Now we have your self-directed learning, so pursuing topics of interest through online resources and personal study. So sa kita, we can do an informal learning through our research in the internet. And your media resources also, like your podcasts, videos, and other digital content, we can also increase our knowledge um, by listening to the experts. So work-based learning. So we can have your mentoring relationship. So learning through guidance from experienced nurses who share wisdom and expertise. So these are commonly for your nurse supervisor or chief nurses who wanted to mentor your novice or your beginners, no, mga novice nurses. So they are really into yung mga senior nurses wanted to share their experiences and knowledge to the young nurses. Then they can do also your shadowing opportunities, observing specialists to understand advanced practices and specialized care approaches. We can do also your clinical rotations, so gaining exposure to different specialties through structured workplace experiences. So in the pediatrics, some of the nurses are also rotated to your NICU, your PICU, and to the pediatric ward. Then we have your reflective practice, so analyzing experiences to extract lessons and improve future performance. So your professional activities, We can do your committee participation. So we can join hospital committee, which provides insight into the organizational operation. Example, you have your quality improvement, infection control, and your ethics committee. You also have your conference presentations. So sharing knowledge through presentations, also, it refines your communication skills and builds your professional recognition. So, example, your poster sessions, panel discussions, and your formal talks. Or we can do your professional writing. So, we can contribute to nursing journals or publications, which enhances our critical thinking. So, it ranges from your case studies to research articles. So what are the benefits for your individual nurses? So your CPD, it enhances your knowledge. So it deepens our understanding of clinical practices and theoretical framework. And also it improves the skills of the nurses. So it defines the clinical techniques and better patient assessment abilities. And also for your career advancement, especially for your specialized nursing um, rotations, and you can also have your job satisfaction, so greater confidence and sense of accomplishment in daily practice. So what are the impact on patient outcomes when we are having our CPD journey? So evidence-based care, so we can implement the latest research supportive practices or your evidence-based practices. Then we can reduce the error, so it means fewer adverse events through improved competency. And we have shorter hospital stays, so more efficient care leading to quicker recovery. And our patient will be satisfied because of our skilled and knowledgeable care. So this is the career development map of our future nurses. So first we have your entry level nurse. So we have your focus on core competencies and fundamental skills development. We have an experienced practitioner who is specialized in clinical areas and enhanced leadership abilities. We have an advanced practice who happen to have a specialized certifications and expanded scope of practice. And we have a patient who have a leadership role. So management positions with broader organizational impact. So we have here your Benner's 5 stages of clinical competence. So in 1 or 2 years from now, we don't easily go directly to expert. So we always go on with levels, no, from novice, advanced beginner, competent, proficient, and expert. So here, in a novice, which will be your we have your young nurses. So we have the educational background and foundation. So they have no previous experience in nursing situations. Then we have your advanced beginner, your nurses there in this group, they have developed clinical experience. They have, they have experiences enough for your real situation. Then the third one, we have a competent nurse. So they have organizational development, so they are able to prioritize the care effectively and develop confidence and skills. So typically, if you're a competent nurse, you have a 2 to 3 years experience. After confident, you're now a proficient nurse. So you have perceived situations as a whole rather than parts. So your patient care over time, you can recognize the changing relevance, you can see the big picture, and identify subtle changes before in your vital signs. So these are your specialized nurses na. No? Ito yung mga nursing supervisors. They were able to mentor the other young nurses. And in the top of the pyramid, we have an expert. You're an expert if you have a clinical wisdom development. So you can use past concrete experiences, relies on intuition rather than rules, and adapts care based on subtle patient changes. So an expert, you no longer relies on analytical principles. You have a deep understanding of total situation, and your performance is fluid, flexible, and highly proficient. So that is your Banner's 5 stages of clinical competence. So how do we overcome some of these CPD barriers? So we identify your challenges. So common barriers include your time constraint. No, wala ng time to um, do with your CPD journey. There's financial limitations, lack of employer support, and many nurses struggle with work-life educational balance. So we create solutions to that. So we can develop micro-learning that fit your busy schedule. So kung dili pwede ang mga um, on-site na mga CPD, then we can do your online or webinars. Then we build support systems. We connect with mentors who champion your growth. So we advocate for learning cultures at work. And we share our resources with colleagues facing similar challenges. Then we document our CPD journey. So we check our professional portfolio. We do your digital tracking for our CPD because now we have our requirement for your renewal of your uh, license. So we have to have at least um, I think it's around no, per year at most 60 units, but I doubt if it's now being repealed or being changed. Then we can do your reflective journals. So we document the thoughts about the learning experience and analyze how new knowledge changes our practice and impact patient outcomes. And now for your assignment, in a short one-paper handwritten portrait orientation, you answer the following questions. First, why continuing professional development is important in the nursing profession. Then discuss your roadmap professionally. Where do you see yourself in 5 years, 10 years, or 20 years? And you submit that on May 20, 8 a.m. at the Dean's office. Now, for your key takeaways for our CPT action plan, we begin our CPT journey today. So we set our goals and we seek diverse learning opportunities and maintain regular reflection. So remember that small, consistent efforts build significant professional growth over time.